folks on the call. We're excited that you're one of them. And so thank you for being here. So this is the Supporting Youth and Building Leadership in Prevention series. And this is session 1 of what will be, suddenly the number escaped me, 5, correct, Eric?
4. Oh, 3, I'm sorry.
3, okay, 3. Well, I was trying to add some work to your...
No problem, more than merrier.
This one obviously is building a youth prevention system. And Derek has planned an amazing training for you all today. And so be thinking about your youth prevention system and the questions that you have, and make sure this is an interactive training today. So be sure you ask those questions and get your questions answered. So I'm Wanda West. As I said, I'm the product development and the distance learning coordinator for the Southwest team. Derek Newby is our TTA specialist who will be presenting today. He is the star of the show, but you all are also the star of the show, because I think some of our best learning happens when we learn from each other. So please get your ideas in the chat box and participate, because we have so much, especially when working with youth. We have lots of varied experiences, and when we share those, we can learn from each other. So lastly, I want to introduce our 2 tech folks that are supporting us here today, Richard Feinberg and Lori Smith. Also joining us from University of Oklahoma to support us, our technology. So if you have any problems with technology throughout the presentation, you can private chat one of them, Richard Feinberg and Lori Smith. Introduce yourself in the chat. And okay, so we are, the PGTC is funded by SAMHSA, the Department of Health and Human Services. The opinions that are expressed here today are not necessarily the opinions of SAMHSA. They are of the Southwest PGTC. These documents are therefore public domain, and they can be copied and utilized outside of this situation. So if you would like to go and share this with your coalition, with other leadership or other youth, that would be wonderful. As long as you do it without a fee. So now let's get some more practice. You all have been coming in, introducing yourselves in the chat box and letting us know what city and state and where you work. And we appreciate you doing that. It's so great to get a sense of who's in the room. Now, if you will, put your name and tell us what state you live in without telling us what state you live in. Does that make sense? This is a little Facebook thing. So I'm Wanda West, and I live in a place with lots of tornadoes. Tobacco. Okay, where is that?
Kentucky. North Carolina, okay.
North Carolina, okay. Beantown.
Beantown.
I can't. Green Chili, New Mexico.
Bill Clinton, Little Rock.
Oh, these are good. They're coming in so fast. Barbecue and tacos. Is that Texas?
I would say so.
Yeah. These are funny. I'm gonna have to send these out to
Windy City, Chicago.
Okay. The Grapes of Wrath. Somebody's gonna have to help.
Still looking for the Little
Rock. As you continue to do that, we're going to turn time over now to our trainer, Derek Newby, and I'll let him kind of introduce himself and get us started.
Okay. Well, my name is Derek Newby. It's a pleasure to be with you today. best way that I can introduce myself is say that I am a part of this system, a product of this system. From the time I was a young child and involved in programs like the Police Explorers program, I believed in systems and how things can change if people work together. I'm the father of 6, and I've shared that belief with them as well. That is my most proudest achievement, is raising good children who have grown to be great adults, working in healthcare and in prevention as well, and at universities. I think that is the best that we can hope to do in this world, is to raise good children who are productive in society, which gives me the passion to do the work that I do, and especially to talk about this topic that we're going to talk about today. Today, we're going to take some interesting ideas, and I'm going to do my best to explain them in a way that will make them easy to use. When you leave here, I want you to be able to apply systems thinking to the work that you do, the work that you do with youth. You will understand how to use the strategic prevention framework as an underlying structure to develop you in these prevention systems that we are creating. You will understand how the principles of prevention can be used to support the development of young leaders that are interested in transforming their communities using the science of prevention. My job today is to talk to you about this topic. Your job today is to participate as much as you can and to listen. Hopefully, I finish my job before you finish your job. I have just a few expectations for our time together. First of all, I'm thankful. Thankful for each and every one of you. Thankful that you took the time out of your day to be here. And I ask that if you're able to, that you give me the gift of your face. I love to see smiling faces. I love to see nodding heads. But if you cannot, then I do ask you to be active in the chat box. I love to see yes. I love to see I get that. I love to see I understand. See, besides being preventionist here in Arkansas, I'm also a minister. So when I get those amen moments and people are agreeing and nodding, then it just gives me more energy in order to give that energy to you. And we start vibing. Thank you, Richard. So if you could just warm up your fingers for a moment to me, just a little Southern in me now, and just everyone hit me with a good morning, because that's one of the things that I miss. I work remotely here in Arkansas, so I don't get to go into an office and see people every day. And that's one of the things I miss, is all those good mornings. Thank you for sending those vibes to me. I love the good morning vibes. I appreciate that so much. Yes, good morning, good morning, good morning. That was the highlight of my day when working in an office with people. I also want each and every one of us to be mindful that we need each other. We make each other better. So ask your question, because someone else may be out there wondering the same thing, and share your challenges as well, because I don't want anyone to feel alone. As we do this work, we've all had challenges, and we can help each other. And we're going to also provide a little time to celebrate those successes, because we always need that inspiration.
You look great.
And I hear what works for you, and your peers hear what works for you. It gives someone else an idea of something that they could try. One of the famous phrases that I remember when I started working in this field, when I was in a meeting and somebody said, let me piggyback on that. Because that meant I get what you say, and let me add another little level on that to show you that you inspired my mind. I want you to close your eyes right now. Close your eyes. Trust me. Trust the moment. Close your eyes and clear your mind. Your minds are clear, and I ask you, what words do you think of when you hear the word system? What words do you think of when you hear the word system? Okay, now open your eyes and put those words in the chat for me. Support, ooh, healthcare, patterns, collection of processes, teamwork, ooh, powerful, structure, pathways, criminal justice, collaboration. There is no wrong answer because thinking is all about making connections in the brain. Your thoughts reveal how you think, and the connections of ideas and feelings and memories and knowledge about the word. And in this case, the word system. And how you think and feel about this word shapes how you feel about systems. The word itself can generate many thoughts and ideas depending on each person's mental model. These are some definitions that I found. And multiple elements interact according to rules to form a unified whole is the one that I can relate to. But all of these definitions have merit. Today, we're going to discuss how systems thinking can be used to help build a youth prevention system. A system where youth interact with their community as a part of a unified prevention system. A system in which they are not just the receivers of services, a system where they can have an influence on their environment while operating according to a set of rules. A prevention system where youth are supported and young leaders are developed. So why build a youth prevention system? You can answer in the chat, please. Why build a youth prevention system? Okay, I see the answers coming. Sometimes it's the only way to get adult. Okay, nothing about us without us. Excellent. To lessen the interventions, to let their, oh my, these are amazing answers. Collaborative and empowering. They are the collaborating with youth versus making them a project. Amen. Why build a prevention system? To provide support. Excellent. All of these are great because a youth prevention system is a valuable addition to the substance misuse prevention system itself. They can also function independently. Youth have already proven that they can change the world, and they have often mobilized with this mission in mind. Youth were very active in the civil rights movement. Youth have helped integrate schools and recently marched for civil rights in several movements to highlight the need for change in our law enforcement system. This has happened spontaneously, as well as based upon issues. But even then, someone emerges to lead by creating a mental model to unite the people. Mental models are part of a system. They're a part of systems thinking. Many of the current programs for adolescents simply focus on peer and family relationships, school connections, and youth confidence to prevent drug misuse. However, I think it's also important to note that a new study published in March 2022 from the University of Illinois suggests another factor may be equally or even more influential. And it's whether the youth believe drug use is wrong. Alan W. Barton and his colleagues found that individual beliefs that drug use is wrong had twice the magnitude of impact compared to other risks and protective factors, which suggests that influencing adolescent beliefs about drug use may be an important key to modifying their behavior. The researchers based their work on the cognitive dissonance theory. And the basic idea of this theory is that individuals strive for harmony or agreement between their beliefs and their behaviors. And when there's a disconnect or dissonance, they try to reconcile by either changing their behavior to match their beliefs or by changing their beliefs to allow for the behavior. Sort of like how our work significantly helped to decrease tobacco smoking in youth populations by increasing the perception of risk in youth. While at the same time, the tobacco industry started marketing flavored vape products targeting youth. Same youth that know the dangers of tobacco changed their behavior and now believe vaping is safe just because of the flavors. An orange can't be bad for me. An apple can't be bad for me. A youth prevention system can deal with this challenge because when you empower youth, they can educate their peers. And youth listen to their peers. See, our world is full of systems. I want to ask you now to respond in the chat. What systems are you familiar with? What systems are you familiar with? The justice system. Amen to that. I know that. What other systems? The faith system, yes. Corporate, schools, public health and prevention, yes, definitely. All of these are great answers. Anyone say the human system? Like all of us while we're here today? The human body has multiple systems that work together, allowing us to eat, sleep, walk, our skeletal system, muscular system, but those are called biological systems. But we also have, just like someone has said, an education system and a prison system, and definitely shout outs to the person who said a prevention system. Each system operates on a set of principles. This model is one of many prevention models that are out there. This is one of the models that we use in Arkansas. Using this model, the data collected informed us alcohol use was decreasing, then COVID happened. Churches closed, liquor stores remained open, and home delivery became prevalent in many communities. According to SAMHSA, many decreases in substance use have been correlated with policy changes. Policy changes in Arkansas have been driven by prevention systems. The policy change to allow home delivery was not driven by the prevention system. And it's correlated with a surge in alcohol misuse. I'm sure it was an unintended outcome. People were trying to do the best they could, but systems thinking could have helped us avoid this. I'm sure other people saw this in their states as well. Greed-driven, yes. Systems thinking is not a brand new concept, but some people don't consider it before making a decision. That's how I like to look at it. Just out of curiosity and no judgment intended, do you consider this concept in the work that you do? I'm going to put up a poll. No, okay. Thank you for your honesty, people. Yes, answers are flying in. No judgment at all. This is just a question. Okay, we got about 85% of people, 84, that do. That is an excellent statistic.
I was thinking about this for myself. I think that, sometimes I do and sometimes I don't. So I think this would be a yes and no for me. So I'm wondering if there's other people out there that feel it could be a yes or no for them also.
Excellent point.
Maybe unintentionally, I am thinking of the system, but not consciously.
Excellent point.
It looks like most people said yes.
Yes. You had about 86% of people said yes. That's great.
That's pretty good.
But as I said before, no judgment at all. See the results, and I'm going to turn them off. So with that in mind, I want to just reinforce that it's a powerful language. It can provide a unique perspective because understanding systems thinking provides a set of tools that you can use to address the problem. And isn't that why we're doing prevention? Isn't that the reason we want to build youth prevention systems? We have faith in them. Transforming a community is a complex endeavor, and systems thinking helps us to see the forces at work in a community and what systems have created them. If we have that knowledge, we have a better chance of achieving our goals. I only ask you to open your minds today so we can explore this concept and see how we can apply it in our work so we can build good systems. Because if you put good people in bad systems, the bad systems will win every time. This is a picture of the original model that we're going to be breaking down and discussing today. It provides us an image of how systems thinking is a way of approaching problems by asking how various elements within the system influence one another. I'm sharing this iceberg model with you today to explain how it can be utilized when building a prevention system and understanding the behavior one may observe in a system. In the iceberg theory, there are levels. The levels are described as mental models, underlying structures, patterns of behavior, and events. Systems thinking models like this are a way of visually representing how we approach problems. Models like this describe how various elements within a system influence one another. And systems thinking is all about defining a problem, forming a hypothesis, and building a model in order to enact a change regarding the problem. This is empowerment. Because rather than reacting to individual problems as they arise, when you use a model like this, you start thinking about the relationships to other activities within the system. You look for patterns over time and you seek root causes. A link to this model is being shared in the chat so you can download it and print it. And you may want to refer to it during the service and even afterwards. I hope you'll share it with people so that they can have a better idea of how systems thinking works. This model provides an easy to follow framework that helps you find the motivation or what actually caused the behavior to appear. It helps you answer the question, what chain of thoughts led to a problem? In reverse, it helps you to create a system that could influence things to change and even cause new positive behaviors to appear. You can patiently deconstruct situations in a community until you reach the bottom. Then use this model to build a better community. Models like this help us to prevent problems in the future. Models like this help us to be proactive. If we only do events in our prevention efforts, people will see our events, but patterns will not necessarily change. Just considering what we've discussed so far, I have a poll question for you to answer. What are the most important factors? Again, there's no right and wrong answer. I just want to see if things change during the course of this event. Okay. Thank you for participating. Ooh, all of the above is 59% already.
Mm-hmm. Okay, looks like everybody is settled. They keep changing.
okay.
Maybe so. Maybe not quite sure. Oh, more circular than linear.
Interesting.
Good way to think about that. Yeah.
Okay.
All right. So mostly all of the above. About 60 folks said that.
Very good.
Yeah.
Okay.
Two people said events. That was our lowest. And all the above was the highest. Yeah.
This is a very well-versed group of people.
Mm-hmm.
There's the results. Okay. Thank you again. So the mental model that it exists, the mental model, oh, did I skip a slide? Nope, I did. Okay, good. The mental models that exist in a system are the deeply held beliefs and assumptions that lie at the deepest level of a system. Mental models can have positive and negative effects because they represent an inherent frame that colors how a community perceives itself and the world around it. The values which we hold to be important. And the key to understanding the mental model of a community is understanding its purpose. See, it's very useful to have a shared mental model because it acts as a frame of reference and it can represent our beliefs. And you know, we love our beliefs because our beliefs are the concepts we hold to be true. Let me say that again. Our beliefs are the concepts we hold to be true. And a belief system is the thoughts we think over and over again. Mental models can be represented as images also. The Texas flag is a mental model. When someone sees this flag, they think of the state of Texas, the Lone Star State, a value held by many Texans. Am I right, Texas? Are you out there? Yes, thank you. The sign says, drive friendly, because it's the Texas way. Tiffany, yes, thank you, Tiffany. What are some mental models that you're familiar with? You can put it in the chat now. What are some mental models that you're familiar with? They're all over the place. What mental models are in your mind? The SPIF, oh. You've been doing prevention for a while. What are some other mental models that you are familiar with? Oh, George, sorry. Any other mental models? Substance misuse and addiction is a moral issue. Interesting. Poverty. Okay. Now I'm going to ask you a question that's going to really test you. And once again, I need you to close your eyes, clear your mind. I'm going to ask you a question. Are you ready? What mental models do you have related to youth? What mental models do you have related to youth? Open your eyes and answer in the chat, please. Respect. Okay. Conflict between self and my unhealed self. Resilience, empowerment, diverse. Fearless. Oh, yes, fearless. Adaptability. Yes. Seasons or holidays. Integrity. Vulnerable. I'm feeling that. Not giving up. Integrity. Ooh. These are some strong mental models.
I'm so glad to hear all these positive mental models.
Yes. Scriptures. Okay. I am so happy that y'all are sharing these with me, because being aware of your mental models is helpful for decision making. Since no person can hold a physical entity in their mind or fully understand a concept in the exact same manner as any other person, every understood concept is based upon a mental model. And mental images are models. Anyone who proposes a policy or a law or a course of action in doing so on the basis of the mental model in which they have the greatest confidence. Because mental models are so ingrained in our process of thought, most individuals aren't mindful of their existence. This is why we have inherent bias and blind spots about different situations. The sad part is companies that make substance are highly aware of this fact. They create mental models of their products when they market them with a purpose. Let me tell you a story. When I was a child, I wanted to be cool. I thought my dad was cool. He smoked cool cigarettes. And when I walked into a store in my community, there was a picture of a cool guy with a beautiful woman and a cigarette in his mouth. Guess what kind? Anyone want to guess? That's right, Cools. They even had an ad that read, "Got a cold? Smoke a Cool." These mental models impacted so many people in my community, but in a negative way. And my community is still feeling the impact. Even though they put all these restrictions on advertisement of cigarettes and trying to remove menthol, the damage has been done. But I propose this to you. If communities learn to use practices like this and create mental models of their ideal communities, they can become internalized and beliefs can change and people can influence more policies to be created to improve their community. A youth prevention system increases the likelihood that youth can help shape these new communities. You may understand this idea as a vision, and I'm going to touch base on that in the principles of prevention, because spending time creating your mental model will help you build a system that people can be committed to. And using the principles of prevention increases your likelihood of success in building good mental models. If you can, I'd like you to use a link that's going to be posted in your chat to download NIDA's Principles of Prevention. The youth coalitions that you create for your system are likely to implement and even create programs. And this is a great strategy, but they should be guided by principles. And luckily, there are many resources available. One of them is the 16 Principles of Prevention programs. And these principles come from a research-based guide for parents, educators, and community leaders named Preventing Drug Use Among Children and Adolescents. The principles are divided into 3 sections, including risk and protective factors, preventing planning, and prevention program delivery. It's important to include and apply principles when building a youth prevention system as well, because when they are not applied properly, prevention programs and systems could do more harm than good by accidentally transmitting messages not based on the principles. One one may unintentionally encourage you to use drugs. You don't want to create a system that does not do what it is intended to do. When I did work at Mid-South, one of the examples that was given to me was the drunk goggles. And they came on campus and all the kids ran and flocked out there so they could ride the golf cart wearing the drunk goggles. And us as preventionists were shocked. We used it as an opportunity to try to educate those who were doing it, but I'm sure there's some unintentional outcomes that happen. And we want to make sure that we step out there and we prevent those whenever we can. We know the risk of misusing drugs involves the relationship between risk factors and protective factors, but remember the latest research also suggests heavily considering the perception of harm and cognitive dissonance. Things like the drunk goggles lower perception of harm because youth get confidence by wearing those goggles that they can drive under the influence of alcohol. And one of the principles is to know your community and communicate to get a clear understanding of the scope of the problem. We learned our community on campus. We learned a little bit that day. And we started getting a bigger scope of the problem. You should do this as well, because doing this will help you target modifiable risk factors and strengthen identified protective factors. After we did that, we no longer saw them using that practice again on campus. You see, a youth prevention system that incorporates these principles can do this as well. And when they do it, they're more likely to do what they are intended to do. Let's move to the next level. The next level of the pyramid is underlying structures. And these are often represented with flow diagrams, models, and feedback loops. Most of us understand this concept in prevention represented by a logic model. Underlying structures support patterns of behavior and events, and they are informed and created by the mental models, which we just got through talking about. So, have you recently looked at the policies of your agency? They're part of the underlying structure. I ask you to reflect on this because various underlying structures usually inadvertently have complicated systems meant to do good. Think about grant programs. Programs created to mobilize community members. Many are instructed that they have to follow the rules of the agency when they receive those resources. Many of those agencies are structured in a way that don't allow volunteers to be paid. When you are partnering and empowering communities to create a prevention system, some people will expect compensation. Understanding this will help you design your underlying structure so you can avoid this problem. Nobody ever wants to put in place a solution that's going to fail. However, this happens often, and usually it's predictable. In the rush to come up with a quick solution, it's easy to address the problem at the level of a symptom instead of going deeper into the root of why it exists. Why it exists. And that's the underlying structure. The lesson to take away with you from this section is before attempting to deal with the situation, develop an understanding of why the system is behaving the way that it is. Because the underlying structure provides a view of the interactions between the elements of the system, which are responsible for producing the patterns of behavior. So you learn the leverage points. Leverage points are those influences within a system where small changes can affect a substantial change in the system itself. Recently, the international youth development field has acknowledged that thinking in systems and purposeful actions at the systems level is critical for achieving positive outcomes for youth. sustainably, equitably, and at scale. So what are some infrastructures in your state that would support a youth prevention system? Think about it. Are youth disconnected from the current systems? Or are youth being served by a fragmented system? When I see the schools doing prevention, the juvenile justice system doing a little prevention, the faith-based community doing a little prevention, law enforcement doing prevention, and even some private businesses involved in prevention, it tells me we have a fragmented system. So I have a question to propose to you. How do we build connectivity into a youth prevention system? I'm going to stop and pause right here so people can answer. I'm going to read some of those answers.
Communication, yeah.
Yes.
Community networking, collaboration.
Excellent.
Working together, bringing everyone together, that seems to be a common answer. Trust is another one. I think that probably can be a barrier also, but being able to create trust, engaging with partners, continuity among the systems. That's creating some of that, building relationships, meeting people where they are. Yes. I think a lot of these people must have attended some of the coalitions.
Yes, they have. They are well versed. Yes. Native telephone. What is the native telephone? I'd love to hear more about that.
Yeah.
Include the youth in planning. Yes.
Gossip. What is that, Joseph?
The Clash of the Titans is an ongoing issue. I think I get where you're going with it.
Yeah.
Like you're saying, all these big systems are clashing with each other. Am I right, Jerry? Like in a safe place, trust, yes. Other people talking about everything.
I think we saw some patterns in there: collaboration and networking, building trust, trusting relationships.
So great. I hope some people are writing down some of these ideas as well. I want you to say these. Peer education is wonderful. What we learn from each other, I mean, it makes a big difference in the work that we do. I have some great ideas that you're putting out here.
Yeah.
Yes, I got it right, Jerry. Thank you. Thank you. Must be because we're both from Arkansas. Okay.
Iris says, even within our state systems, we have multiple programs across different agencies working on prevention and not working together. So even within the state system, yeah, that's very true.
More conversation on the collaboration that are happening. When you feel like everyone is doing it, you want to be a part of it too. Say less, say less. You got that. So programs are traditionally designed to reach an audience in its primary setting. We get that. But a youth coalition in a youth prevention system have the power to directly impact the intended population and the community in multiple settings. It's fair to say youth have access to other youth 24 hours a day in most cases. When they use the strategic prevention framework, they have a proven model with guidelines. And funding will always be a challenge. It's always been an issue when you're dealing with different infrastructures. Everyone wants to get paid. So consider this when building your system as well. And don't be afraid to be innovative. Just remember, the programs are secondary. Thinking about what's going to be needed to make your system sustainable and equitable, that's primary. With the current fragmented system trying to do prevention, the question should not be whether a system's approach is needed, but rather how to best practice it in youth prevention. Because collaborations allow us to do more than we are capable of on our own. In my references, I include a journal article about building youth infrastructure called Early Lessons from the Youth Systems Collaborative. And I urge you to download that and read that article as well. Flower time. Does everyone know what this is? Does everyone know what flower time means? The strategic prevention framework is a proven model used to guide prevention system, and it works when building a youth prevention system as well. Yes, the SPIF. It's free. It's a solution to urgent substance misuse problems facing communities. And research and experience have shown that prevention must begin with an understanding of these complex behavioral health problems within their complex environmental context. Only then can communities establish and implement effective plans to address substance misuse. This toolkit provides an introduction to the SPIF's well-tested and user-friendly planning approach, and we encourage you to download this resource. You can get it at samhsa.gov. We're going to post a link as well. So if you're not familiar with how to get there, then you can. In order to build a prevention system, one must learn that issues matter to the community. And what resources may or may not be available make a difference in how you're going to deal with and assess that community. And the history of the community is important. Since many of you work in communities, this process may seem familiar. And some youth-specific data has been readily available to us in the past, but these last 2 years have proven to be a challenge, and information may be missing. So I'm really looking to each one of you to help each other at this point. When I ask the question, what systems currently collect data in your state that can be used in youth prevention efforts? What are you doing in your state? And where are you getting your data from that can help in youth prevention efforts? Missouri Student Survey, thank you. Point in time count survey. OPNA, ooh. Started doing youth focus groups, excellent move. That's a pivot. Student surveys, Missouri Student Surveys, Youth and Action Boards, okay. I'm looking for those innovative things that are being done so others can see what they can do, because this has been a challenge. Stakeholder interviews, wonderful. Youth-led coalitions. Okay. Focus groups, wonderful. Oklahoma Prevention Needs Assessment or Statewide Prevention Survey, okay? And I even ask some of you at this point to, think outside the box and start talking to community activists. Those are the people that are on the ground in the community, working at all times to make things better. And those activists may have data and real-time knowledge that could help you. Also, in trying to build a prevention system, make friends with people who work with you. Because communities aren't always readily willing to give you access to their youth. But if you make friends with the people who already work with the youth, you have a better chance of accessing youth and the data that's related to the work that they do. People can help you. People are our resource. Building capacity of youth is part of the process as well. And we'll It's going to have to be repeated over and over and over again on multiple occasions. And building capacity of the system is an ongoing cycle. This is why the SPIF is such a great model. The leaders you develop should be empowered to build youth coalitions in a culturally competent way. And we offer technical assistance to help preventionists develop logic models and action plans here at the PTTC. You see, the overall problem can be identified using data, but people are your greatest asset. You should be at the table when building a youth prevention system, obviously. But what are the norms in your community related to youth leadership? Answer this in the chat for me, please. What are the norms in your community related to youth leadership? You have to really dig deep and look into your mind and think about it. You know your community. What are the norms? The youth who are leading youth or adults who lead youth. What's the norms about working with youth in the planning process? Adults working with youth. No belief in the youth to lead. Wow. Adults doing the work and not letting the youth lead. It's common. It's okay, it's common. We're gonna change that. Coalitions working with the youth. Okay, that's good. Allow them as long as they don't push our values. Youth-led, adult-guided. Yes. We want to see more of that. Youth not having motivation. Oof. All about the adults leading in my community. I feel you, Jay. Tokenism. Oof.
Yeah.
Those are things that we're going to have to change. Wanda, did you want to say something?
Well, I'm just thinking about this and thinking about earlier when we were describing the youth.
Yeah.
And all the positive things that we had to say about them, and then to see this being so negative and just,
yeah,
they have
reality.
They have so much to add and contribute.
It's important that you guys know this, because passion is going to bring people to the table, but you must involve them in the planning to keep them at the table. And the reason why is simple. When we do prevention with youth and share the power with them, the youth gain power. And they gain the power to work within a prevention system. But when we don't share the power and try to do prevention on you, it's not clear to them what their role is. And the youth are likely to disengage. And when working with youth and planning to build a system, it's okay to provide guidance. But that guidance should be to help them. It should be to help them as new leaders so they can plan considering what they want to change and making it clear to them the changeability of some things so that they understand them. Remember, good things happen when opportunity and planning meet. The implementation phase of the SPIF is when programs are delivered. Youth prevention systems are very useful during this phase. They can work with other youth all over the state to develop a unified message to promote equity, collaboration, and partnership to decrease substance misuse. And since all communities are different, you should plan for adaptation and balance fidelity to retain core elements. Instead of treating people the way you want to be treated, you're going to have to learn to treat others the way they want to be treated, and ask for specific needs and accommodations required for them to engage. Because establishing support and monitoring protocols will be helpful. Many factors combine to influence implementation and support the success of the prevention efforts whenever possible. In session 2, we're gonna Next month, we're going to focus on diversity, equity, and inclusion as it relates to this process. And I think you'll be really excited about the information that we're going to provide. Cannot forget evaluation. Evaluation is about enhancing prevention practices. It is the systematic collection and analysis of information about prevention activities to reduce uncertainty, improve effectiveness, and facilitate decision-making. When building a youth prevention system, conduct evaluations regularly and use the information to make changes, but always share the data. Do this with youth leaders so they learn how to do it and how important it is in prevention. I urge you to make your systems youth-led, as it was expressed earlier, and also culturally competent, because adultism is real. Adultism can have a severe negative effect on youth. When experiencing adultism, youth lose their self-confidence, their self-worth, and their ability to function in the world also diminishes. Adultism can also lead youth to act out in unintended self-destructive ways. Be aware of it and make sure that your programs and your systems are culturally competent. So when youth become involved, they don't get hurt. A prevention system with empowered, knowledgeable youth have the capacity to plan and adapt to their local communities. They essentially become the change agents with the qualities needed to truly influence other youth to adopt behavior change because they are their peers. And in order to maintain consistent quality services, one should consider these contributors listed on the slide because they impact sustainability. Social impact, prevention focused, adaptability, the capacity to deliver, and of course, no adultism. We talked about the SPIF, and I know I was brief, but we talked about it because it's one of the underlying structures in prevention used as a framework for programming, and we know it works. I ask each of you now to answer this question for me and for everyone. What are some examples of ways you've used the SPIF to build and sustain your youth prevention systems? Please use the chat. What are some examples of ways you've used the SPIF to build and sustain your youth prevention systems?
I think you stumped everybody on this one.
Oh, they're coming in.
There we go. We had to think about it for a minute. Okay.
It is a thought-provoking question.
It is, it is. So Jennifer says, we've made our assessments youth-focused and for capacity building are also targeting indirect populations who work with youth. That's great.
Mm-hmm.
Okay, involving youth in the planning.
Very good.
That's good.
We use the model to educate and teach our work groups.
Georgina says, I've created a coalition for youth sponsors, adults to connect and collab across Kansas instead of fragmented prevention scattered. It's great. Youth voice, continued conversation, and listen to our coalition.
You guys are touching my heart. I'm telling you. I feel it.
Some focus on capacity.
And teaching them to teach their peers. Amen. Thank you, Joycelyn.
Hopefully,
I mean, I know I'm overreacting because you look just, I don't even know what.
We have somebody, there we go.
Peer-to-peer teachings. Yes, Joseph.
Emily says changing the mental model of what adults can do for them. That we trusted and we do want to see the best in them.
Guidance to continually improve a multi-tiered prevention approach to meet all needs of youth, universal, targeted, and indicated. Okay, Brandy.
Joseph says peer-to-peer teaching.
Mm-hmm. Oh, I am so proud to be in a field with people like you. I'm so proud to and thankful to have people that love the spiff the way I love the spiff. With that in mind, let's move on to the next level. The next level of this model we're going to explore is patterns of behavior. Oh yeah, we're getting to the top now. Hang with me. Because in systems, the presence of a pattern indicates that there are several factors acting in feedback loops. And those feedback loops are caused by underlying laws or structures. For example, if each weekend the number of people arrested for disorderly conduct increases, what is happening? Does law enforcement increase patrols on the weekend? Is more alcohol being served on the weekend? Does the community have clubs or bars that only open on the weekend? What's been happening? Was there ever a point in the history of this community when there was a pattern when arrests were decreasing? That's what we need to know. And what other trends are also happening? What are the patterns of behavior that are also occurring? Because patterns of behavior are often associated with individuals. That's not where we look for change at when we have systems thinking in mind. In systems thinking, we focus on the patterns of behavior of the community, the group, because the groups in the community and the community as a whole give us the answers that we need to change course. That is where we can affect change. These patterns of behavior are things that are generally unseen. In a prevention system, it's very important because this is actually the level at which our system is tasked to measure data. This is where your prevention system measures the changes that occur over time. And some of the driving questions at this level for your prevention system are, what has been happening? What are the trends? And what changes have occurred? There are tools available, of course, to collect this data, and you can create your own. But it's also important to identify systemic issues at this level as well, internal and external. Evaluations should be ongoing. And your prevention system, it has to look for those patterns, because patterns generally involve repetitive behavior that people of systems do without giving it much thought. Communities have patterns and activities that are done so many times that the inherent harm in it can't even be understood. Question. Think about your own community. Are there some patterns of behavior in your community that are harmful to the community, but accepted by the community? Think about it. Yes. Underage drinking? Often, yes. The good old boy network. We know that's a part of the system. Sometimes it works for some people, sometimes it don't. Uneven rules for women versus men. I got 5 daughters. Marijuana use, vaping, nepotism. Ooh. We live in these communities. We see these things. We know they're harmful. We have to handle them systematically, and systems thinking can help us deal with it. Plain old denial. fighting in school and bullying, yes. Intergenerational trauma, it's a fact, yeah. ACEs. The prison culture. Funny thing in my culture, I just thought about, like, we have bigger parties for people when they come home from prison than we do when people graduate from college. Ain't that a shame? Instant gratification culture, yes. It's a big one. Julio, you guys you keep me motivated. The way we even label you, yes. Information overload. Thank you. See, in order to understand these patterns of the community, they should be studied first. Like, one particular thing that comes to mind, I think you can all relate to, is cannabis usage increasing. It increased when it was legalized. And that was a predictable pattern. Colorado provided us clear data related to this pattern, and it was studied. The industry worked hard, though, to market it as medical. See, they changed their strategy. We already have a mental model of what medical means in our minds, a shared mental model of what medical means in our mind. We do, our legislators do, the community does, and the results were more states legalized cannabis with the mental model of what medical means in mind. This is a battle that we are fighting in the prevention field right now. For our prevention system, that means ensuring plans are in place, though, to enhance the knowledge of community members and coalition members about prevention science, and provide them with quality, understandable, and accessible data so they have a better understanding of the patterns of behavior that have occurred in other places. And using these questions that you see on the slide, they can study phase trends and help mold the patterns of behavior in a prevention system. Prevention systems have to develop in a way so that they can remain stable while also affecting change. So when you're building your prevention system, think about the changes that may occur in the patterns of behavior and plan for them ahead of time. Oh, I can't believe we done reached the top, the tippy, tippy top. The next level is events. It's not the events in life that shape us. It's our belief about what the events mean. Because events are observation, the things we observe in systems. This flows in multiple directions. Events influence patterns of behavior, and patterns of behavior influence events. Observing events can help a system identify problems. And using that information, you can solve problems with youth prevention systems. Are you with me? See, some events occur because it's within the historical context of the community, while other events occur as a result of a prevention system. Problems that are ideal for a systems thinking intervention have the following characteristics. You want to write this down. The problems that are ideal for a systems thinking intervention have the following characteristics. 1, the issue is important to the community. 2, the problem is chronic, not a one-time event. 3, the problem is familiar and has a known history or pattern that you can study. And 4, people have unsuccessfully tried to solve the problem before. If it meets those 4 criteria, you have a problem that is ideal for a systems thinking intervention. All of these events are things we are able to observe. And as you move toward building a prevention system, I challenge you to look at your work and your events in a closed loop structure also. In this structure, there's no beginning and no end, just like the spill. Just a complex of nested feedback loops. And every action by your coalition affects your community. Every change in your community provides you more information about the problem. That information leads to new action. And that action can be seen by your community. An action of your coalition as a system based upon the direction they are trying to move the community. And this continues to happen, building momentum, building a movement that is supported by the prevention community with a shared mental model, underlying structures, monitoring the patterns of behavior and sharing information in an open forum so the data can be used as leverage to support change. Youth prevention systems are going to face challenges. I know a youth coalition that was ignored in Northwest Arkansas. I hope Deb here. Deb Crawford helped that youth coalition. When they approached city council members asking them to ban the sale of cannabis before businesses started to sell it, those city officials were shocked. And they ignored the youth. But they started attending city council meetings. Yeah, and they kept coming back. And they kept coming back with data until they were heard. And an ordinance was passed in Northwest Arkansas in a city prohibiting the issue of a business license to any company that planned to sell cannabis products. They observed an event in their community where they could affect change, that city council meeting. They organized an event to attend that meeting together as a system. They shared their prevention message and they used their power to prevent a future problem. That coalition was and is a part of a prevention system doing exactly what they are empowered to do. The youth coalitions are part of a RAD system. The RAD system. This is the system model that was initially shared with the PFS grantees in Arkansas when they were building the youth prevention system. Youth coalitions were developed as a vital part of the youth substance abuse prevention system, just like the adult coalitions have functioned for years. And each coalition worked in their community with a regional lead representative. The regional lead representatives received funding from the state to support the efforts of the youth coalitions, guided by the underlying structure of partnerships for success. The patterns and behaviors of the community were observed and data was collected and shared with the Division of Behavioral Health. So decisions could be made in the system for the whole. The events are what the community witnessed because of the events the youth had witnessed in their community. And the youth knew the patterns of behavior in their communities. Instead of youth just receiving services here at the schools, we empowered them through capacity building efforts and brought them here. Where they helped decide about the strategies that would help decrease substance misuse in their counties among youth. As a system and working together, they are connected and can impact the whole state. Like health departments have local health units in their system to deal with local problems. Local youth coalitions have the ability to deal with local substance misuse challenges in their community among youth. See, this was not the beginning. I'll tell you, Lead and Seed was a program. We tried that. Say It Straight was a program. Both were previously used to serve youth, This time we did it different. RAD is a system designed to transform a state with a comprehensive statewide effort designed to share drug prevention information with community stakeholders, school leaders, faith-based groups, and business leaders alike using evidence-based strategies. We didn't wait for them to bring it to us. We brought the connection to them. The youth in the prevention system helped decide if strategies should be school-based, family-oriented, or community-based to reshape the risk and protective factors in their communities. The way we did it made all the involved youth feel connected. They became preventionists. When they saw a RAD commercial or passed a billboard in their city, they knew they were part of something bigger than themselves. They were part of a prevention system. And that system helped get ordinances passed, banning the use of vaping products in city parks, ordinances passed banning the issuing of licenses to stores with an interest in selling marijuana or cannabis, and school policies passed that brought vape detectors into the schools and changed how violators were impacted. They wanted education instead of suspension. Our change was not an event. It was a process. To be honest, I felt a little overwhelmed by the idea when it was first proposed. How do we build a youth prevention system? But General Dean from CADCA came to Arkansas and he challenged us to do it. I could never walk away from a challenge. We have 75 counties in Arkansas, and the goal was to create a curriculum and data-driven message engrossed in activity centered around changing behavior. And building on the underlying structure of PFS, we decided to develop and support a youth coalition in every county in 1 year. We had an adult prevention system in place and representatives in most counties. Partnerships for Success provided resources from SAMHSA and an underlying structure. But our most important resource was the youth. Young people are the experts on their lives. Unfortunately, many times, they are not seen as experts, and systems leaders may not involve young people in decisions about their own community or about how the system should operate to effectively support young people, their families, and communities. But we were aware of this because it's a pattern of behavior. And using systems thinking, we were determined to make sure we avoided those obstacles. So we began working directly with the youth to create a message that they would support a mental model. If we were going to get a message out, we essentially had to turn the Arkansas youth into walking billboards. Rise above alcohol and drugs was the message they rallied behind. And they lined up to even our dismay in surprise to get these t-shirts to spread the word at events like the one you see in the picture. They were excited to be invited in and be a part of the system. And they wanted to see change. They wanted better communities. So if anybody ever asked me, like, how can you make youth and potential members like clear about the why or the importance of the youth prevention system, I'd have to point you toward our coordinators and sometimes even our drug director, because they swore them in as preventionists. And they asked them to take an oath to let them know we're on the same team in prevention in Arkansas. One team, one fight was the anthem of our director, Tanisha Barnes, not just to us, but to all members of the system. We were able to teach youth how to implement prevention in ways they could understand. And RAD was the message echoed by everyone in the prevention system, still is. I want to show you a video because it's worth 1,000 words. And my friend Alex Smith, PFS coordinator for his region, still continues to lead the way in building youth substance misuse prevention systems, just like the rest of the coordinators in Arkansas. And he does it using the 16 principles, and he does it with the passion you can't purchase with a paycheck. He's here today, and I'm going to ask him to talk with you And I'm gonna give him a couple of minutes to talk after the video plays. And he'll tell you about what the youth are doing in prevention in his region. But as you watch the video, I want you to note what systems are working together. What systems did you see when working in collaboration in this video when you watched it? Hold on one moment. I have to. Share. Trying to get the sound. Wanda, can you hear that fine?
I can hear it, but I don't see it.
Oh.
And the sound isn't good either.
Okay, hold on one moment. If there was going to be anything, it was going to be.
Yeah, there's a checkbox in the bottom left corner of the share screen.
Okay. Okay. Where's my?
I can play it back if you want.
Share screen. Got it. Found it.
Okay.
Okay. And. Voila.
My name's Alex Smith, and I'm a Region 11 prevention provider for Harbor House here in Magnolia, Arkansas. Today we're at the Boys and Girls Club, serving the community of Magnolia with backpacks, school supplies, anything that they need to get them ready for the 2021-2022 school year. Our goal is to make sure that we do organizational support from any business and any organization here in Magnolia. We've had an outstanding response from over 65 businesses here in Magnolia with donations, school supplies, monetary value. It's been pretty incredible to see the impact that everybody's making today here at the Boys and Girls Club.
Hi, my name is Denise Jamerson, and I am the Executive Director for the Boys and Girls Club in Magnolia. Boys and Girls Club and Prevention, we are pretty much one and the same. We are here to help wrap the child in whatever they need in order to have a successful and a bright future. The Boys and Girls Club here in Magnolia have partnered with Harbor House, more specifically Mr. Alex, and he has brought some great things here. He started off with coming and volunteer coaching and being a mentor to our youth, and he's just been here every day pouring into our kids, letting them know that there are other opportunities.
Magnolia Prevention, since COVID started, it's been hard to reach youth that we really need to reach. There's a lot of people suffering right now. And sorry to get emotional, but when you look at the disconnect between the kids that don't have a lot and the kids are really the ones suffering at the end of the day, given the circumstances of what COVID has done to our community in general. It's just decimated Southern Arkansas. And so the partners that we have here with Chris and Denicia and the team here at the Boys and Girls Club, they've stepped up in ways that we couldn't ask for anything more. And the partnership is just so important. So from Harbor House's perspective in prevention, we are able to collaborate with an organization that already has such a tremendous reach with youth in general. This allows us to go in, talk about prevention, talk about substance misuse, educate, mentor, all the things that they already have in place. We're just an extra leg on a stool for them. And so our partnership has been super beneficial from their end, our end. In regards to youth, we're just able to reach so many more than we would have without the Boys and Girls Club.
You can volunteer at the Boys and Girls Club to offer a myriad of services to our youth. Once that background check is cleared, you are able to come into the organization, come into our clubhouse, and pour into the child those necessary tools that they need. Part of what we do here at the Boys and Girls Club is to give them the opportunity to be great. One of our taglines is "Great Futures Start Here," and so in order for them to be great, we have to present them those great opportunities.
Alex?
Yes, sir. All right. Well, first, thank you for showcasing that. Anytime I do those, I get goosebumps just filming it with the kids, because they obviously love to be a part of that stuff and tell their story. So just briefly, what you saw there was a backpack drive in Magnolia, Arkansas. I serve 6 counties here in South Arkansas, and the current county that I live in Columbia County, oddly enough, where I am at most of my time, is the hardest county to reach. It's the hardest community to serve, because like many of you, maybe across the country, wherever you are, I don't know if you've ever heard the term, "we don't have a problem." And so that when I moved here, that was the big tagline that I heard everywhere I went was, "We don't have a problem here. You know, our kids are fine." And I learned very quickly that that was far from the case, in terms of what I was just seeing and interacting with the kids. So one of the ways we tried to get involved quickly was the Boys and Girls Club. Again, as I had stated in the video, they already reached the kids. So I wasn't trying to reinvent the wheel. I was trying to just go where they already are. I was already in a school. I was working with my church, with Hispanic and Latinx communities. And I wanted to make sure that I got everybody, that's that cultural competency aspect in our SPIF model. So I can't just reach Black, white, brown. I got to reach everyone. And so we went there and we had an assessment meeting where we met with any stakeholder in the community that wanted to be a part of the meeting. We blasted it out through the Chamber of Commerce email. They let us use that for free. And we basically said, we're meeting at this time. We need to discuss what our community needs. After the meeting, we basically came back, set a backpack drive. Pretty simple. It's a way for us to reach the community, see them as quickly as possible, short amount of time. You didn't see it in this video, but that was middle of COVID, prime COVID. And I'm over that now. I don't even like saying that word anymore, but that was during the middle of COVID. We had bouncy houses planned, ice cream trucks, food trucks. You name it, it was going to be there. And as time started approaching, lockdown started happening more and more. We had to shift and pretty much adapt on the fly. So we did a drive-through, which is what you saw in that video. A lot of the businesses that you saw there are pretty big staples here in Magnolia, Albemarle being one of the biggest ones. There are only 2 places in the world that can mine for bromine, which is what is in lithium-ion batteries. Magnolia, Arkansas, and the country of Jordan are the only 2 places that mine for that. And so Albemarle is a really big staple here in the community. And they were the first ones to say, we'll bring the grill, we'll bring the hot dogs. You guys don't have to do anything. We don't even care if we're, in the video. We want to try to let the community know we're here. Once Albemarle stepped up, everybody started just kind of, okay, this is real. They're actually doing something. And so we built silos at the backpack drive. We passed out brochures. We told people about what we offer, how they can get involved. And there's billboards up around the community. So a lot of people that drove through started saying, okay, I know who you are now. I see, and it started, they kind of connected the dots, which again, like many of you that maybe work in prevention, we put those things up and sometimes think that they're not making a difference. But sometimes it's maybe just that one small event that can allow them to connect the dots. So out of that meeting, in closing, because I don't want to just ramble, we were able to build a system of stakeholders where we started getting into school board meetings. We started getting into businesses. We started creating evidence-based practices that we are working on right now, getting into the schools here in specifically Columbia County, because again, as I said before, it's one of the hardest counties to get in where I live. And So we were just able to develop a lot of practices. I presented a Sports Saves Lives campaign to the state. It is not evidence-based. It was more of just an idea. I love athletics. It's what I know. It's what I'm good at. So I thought how I could incorporate that into prevention. I took kickballs, which wasn't my idea at first, the basketballs, baseballs, footballs, you name it. I put the RAD logo on all of that. And I took it to the Boys and Girls Club. I took it to every school in my entire region, which there's 15 of those. I put it in everywhere I could possibly put it in South Arkansas. And that has sort of been, what I'm known for here is the RAD sports guy. Again, it is not evidence-based, but I am working with Mr. Rodney Wambeam. It's a slow process on my end, but trying to look at maybe getting something like that evaluated for a evidence-based practice once we collect more data on if it was effective or not. Because again, it may not be effective, and that's something we have to live with, but it's worth a shot. And if the state supports it, which they have, that helps a lot. So wherever you're at, go to your people and present ideas. And that's all I'm trying to continually do is just present ideas. Sometimes they may work, sometimes they may not, and I'll live with the results either way, but also sprinkling in the evidence-based practices, which we have to have. And that's what we're doing. But again, that's kind of in a nutshell who I am, what I do, what I've done. There's many more of those videos. I try to do them with each one of my coalition. I think marketing is one of the strongest tools we have. We can do it on our cell phones, and we can go buy a little video recorder at Best Buy. But if you have the budget, I highly advise you to get with somebody that does this professionally, because you see the quality of that. I mean, I'm very lucky to have access to that, and I know that, but that can be shown anywhere in the world, and somebody would take it seriously.
Let me ask you a question, Alex.
Yes, sir.
What is what growth have you seen in the youth that have been involved in the prevention system? How have you seen them develop?
I've been working and living in Magnolia for almost 4 years now, and I've worked with the bulk of the same students. So I've seen them develop from, 15 to 19, if you will. And there's a video, which I'm actually about to release to the state, and they're going to, show it, which I did with one of my youth leaders. Her name is Caitlin Ford. And she specifically says in that video, I used to be super shy, and I dabbled in things that I shouldn't have, and I wasn't confident, and I didn't know what I was going to be. And ever since I started working in prevention, I've got this confidence about me where I feel like I can go anywhere and scream at the rooftops about prevention and what it's done for my life and the lives that it's changed around me. I mean, I hate to say it, but, a lot of people that have been in her shoes, we tend to put our families on blast. I know that I have. I mean, addiction runs in my family, and it has circulated generationally. And, but I talk with my family to say, look, we have to tell our stories about where we've come from to where we're going to go. And I say that to say that's what Katie's done. That's what a lot of my youth do. They're not afraid to say, mom's not doing so well, dad's not doing so well. They don't try to be disrespectful when they do that, but they're getting the confidence to say, look, what I have come from is not okay, but where I'm going, I'm about to rock the boat, and I'm all for that. I love rocking the boat. That's how you got to get stuff done.
Thank you, Alex.
Yes, sir. Yes, sir.
You had one question from the group, which is, they said, when you say hardest to get in, what all obstacles are you considering?
So if interpreting the question correctly, when I say the school is hardest to get in, what issues am I facing to get in? I'm from Little Rock, Arkansas, which is the capital city of Arkansas, obviously a bigger community. I went to Little Rock Central High School there. Most people know about the Little Rock 9. They know what Little Rock Central is. I come from a very diverse background. I feel confident in the way that I can speak and who I can speak to. I talk to the janitor, and I would talk to the janitor and the Pope and the president the same. That's just how I was raised. I preface that to say when I moved to South Arkansas, it's a whole set of rules in rural America. If you are not in, you very likely won't get in. If you are not in the circle of how rural America operates, good luck. And when I moved here, I found that out very quickly. And so the issues and the obstacles that I faced were, again, we don't have a problem. Don't come here putting your nose into things that you don't need to be putting your nose into, is basically the message that I was receiving from the powers that be. Wow. And so, you know, but that changed. I started meeting people, and I started meeting parents and community members, and I started introducing myself in a way that was authentic and genuine. And I talked to the mayor and the superintendent and the parents and the Boys and Girls Club and all the people that did have power and influence. And they started kind of basically saying, okay, you know, you're for real. You're one of us, and we accept you. And, you know, we see what you're trying to do. This isn't an issue of, we don't want to fix it. It's just, when you're in rural America, things are tight and closed, and, you know, they don't want to lose their cusp on the social status quo, if you will. And it's not that every place in America isn't like that, because they are, but it's harder when you're in a, you know, where everybody knows everybody. Your business and your dirty laundry is in every household in a, you know, a 10-mile radius. And that's just how it is here. You know, so, but that's the obstacles that I faced. I hope that answers your question.
As you move forward, and this is the last question I have for you, what would you say is the biggest takeaway that you would tell other people when you start working with youth and trying to build a prevention system? What should you do?
Sorry.
And I know how you brought I said you did a great job bringing the fragmented system that you have in your area together to work for the youth. But specifically when dealing with the youth, I just ask you, what would be the takeaway that you would give to any other preventionists if they have to go into this endeavor and have to start empowering youth? I know, deep question.
Yeah, no, well, I'm pausing because, you know, I get emotional, like, doing this work. I've worked in schools, I've worked in government, I've worked in sports, I've worked in a lot of fields. We are all suffering. I come from a psychologist background. Father was a psychologist for 40 years. So talking with people is what I love to do. The issues that we are facing, specifically the youth, as most of you know, the shooting in Texas a couple of days ago. You know, I try to connect the dots. Why we want to prevent kids from using and abusing. That's the goal. But in prevention, what I'm trying to do is connect, you know, why they're doing what they're doing. What is causing them to pick up that joint or pop that pill or take a sip of that beer? What is the root cause? And we can go into many debates about what that is, you know, and everybody has their own opinions, and that's fine. But what I'm learning, to keep it short, is that if you come into this field, just know you are a frontline worker, whether you realize that or not. That's what you are. You're a frontline worker. I'm not saying you're a medical professional or any of that. That's not what I mean. But you're going into the lives of people that are the most vulnerable, and you're going to see some things and hear some things that you may not be ready for. And, you know, you've got to understand that cultural competency means that if I walk into an all-Black neighborhood, whether I know I'm good there or not, that doesn't mean that I can just go in there and tell them what is wrong and how they should live. That's not the case. Sure, I went to Little Rock Central High School. Sure, I was the only white kid on my basketball team for 6 years. Sure, I understand the culture, but that doesn't mean that I don't need to take time to understand the people. And that goes across all races. I'm just using that as an example because that's how, you know, that's what I was raised in. You know, I'm married in a Hispanic family. My son is half Hispanic, you know, and so, but I'm just saying that if you come into this field, you've got to be ready. And, you know, I try to be as optimistic as I can, but things are looking, you know, bleak and maybe getting worse. I don't know. That's my hope, is that it's not that. But every time I pull up my phone, there's a tragedy, there's an issue, there's a this, there's a that, and it just seems like it never ends. And so, you know, I put on my Facebook the other day after I read about the shooting, you know, and it just crushed me. I was angry, and I knew that in that community, that's going to lead to higher substance abuse rates immediately. I mean, it's going to be immediate. And so what I was trying to convey is that you've got to change your small corner of the world. I work with local elected officials. I work with the state officials. And if they allow me, I'm always honored. I'll work with the federal government side too. But I don't rely on that. I rely on walking out of my office today when I'm done and looking for an opportunity to change someone's life, period. I don't need the dollars. I don't need the approval. I don't need the pat on the back. It's not what I'm looking for. I'm going to do what I can to just make sure that the people that I'm around in any given moment are good. And so when you come into prevention, that's what you are doing. You have to make sure the people around you are good. And it's going to cause stress. It's going to cause anxiety. You may lose some of your own personal dollars, but that's what you sign up for. And I love it. I do. I love it. If prevention turns into a long-term career for me, I'm here. I'm here. So.
Thank you, Alex. I really appreciate you sharing with us today. And you got a lot of people in the chat saying amen and thank you. And they feel the same way you do every day. So you are in the right field. We are all together here, brothers and sisters, in the work that we do.
Yes, sir.
Thank you. So
absolutely. And I'll put my contact information in the chat for anybody that may need it.
I appreciate it.
Yes, sir. Thank you for allowing me to speak.
So we're just going over the model. So I want to ask you to answer in the chat. Do you believe that this model will be useful in your work? You can answer in the chat. That'd be appreciated. Do you believe that this model will be useful in your work? Yes, absolutely. Oh.
Lots of yeses.
We still have 143 people here.
Yeah,
I think that's more than we started with.
It is. It is. I've been watching.
You guys are doing your job. I'm going to have to go ahead and finish up mine. Thank you so much for being a part of this today, being part of this movement, and allowing me to share this story with you and share the idea of systems thinking. Systems thinking it's an approach. It can be very informative and it can help bring people together, as you've seen. The systems thinking methodology often produces behaviors that are persistent over time. And that's why it's so important that we do it right. So much so that people may believe the system is self-correcting. We are often faced with this challenge in prevention because problems seem to get the most attention. And when we do our jobs well, problems start to disappear. So having a model that you can use to keep the community aware of why the problems are no longer visible is helpful in prevention. Any policymaker can understand that logic without even seeing your logic model. Models like this describe how various elements within a system influence one another. Systems thinking is about defining a problem, forming that hypothesis, and then building a model in order to enact a change regarding the problem. This is empowerment. You can build a prevention system with youth. So rather than reacting to problems as they arise, your youth and that system can plan activities after examining patterns and execute plans successfully to prevent problems from ever occurring. Models like this help us to prevent problems in the future. Models like this help systems to be proactive. Working with models can enhance systems thinking abilities, and I encourage you to look at this model with your team in the work that you do. After what you learned today, each level should be thought-provoking. Each level, all of the above. The resources slide will offer you additional links related to the information that I've shared with you today. And I want to leave you with this quote. In systems thinking, the true wisdom comes from willingness to let go of the past. That's by Pearl Zoo. In systems thinking, the true wisdom comes from a willingness to let go of the past. Thank you so much for sharing this time with me today. I appreciate each and every one of you. And I want to put you in the hands of Wanda West now as we talk about our next steps.
Hi there. Well, wow, what a great presentation. And I think we've all had some emotions stirred up as we went through this model, and that's the work of it. But really, I think that Alex brought it to us that it's really about the individuals that we work with, and you all are out there doing that work. And so, we want you to think about now from this point on, what are the things that you're going to take away from this presentation? So in the chat box, we'd like for you to choose either something that you will do as a result of this presentation, something you'll improve on, something you'll start or you'll stop doing. So if you'll add that in the chat box. So again, what's something you'll do as a result of this presentation, improve on, start, or stop doing?
Thank you, Samantha. Make more community connections.
Yeah. Making more community connections. That's a good one. Focus on getting folks to include and empower youth. Yes. Strategic planning with youth. Yeah, I saw that earlier and I thought that was a great idea too. Mm-hmm. Get more of the community involved, more collaboration.
Stop making programs for you and make programs with you. There we go. Shut off communities. Yes, you have to reach out to those hidden populations.
Mm-hmm. Putting biases aside. These are moving so fast.
Continue to build and maintain positive relationships in the community. Yes. Community partnerships. Get away from adulting. Learn to let go. And so we can move forward.
I think that's a big thing for many of us is, and that's probably why we want to continue to have control over the program and the system and make sure it's successful, and which is a great thing, but not when we're running over.
Tequila. Stick to my beliefs about addressing the why instead of shutting down. Okay. People don't understand the importance of the why. There you go.
Take a deep breath and push forward. Excellent. That's great.
Making sure the youth are at the forefront of decisions and not just an afterthought.
Mm-hmm. Well, that's awesome. So hopefully you take something today. We will, we're going to pass out, email the PowerPoint to everyone and the recording next week. And so be looking for that. If you have questions, in a few moments, we'll show you Derek's contact information, and looks like Alex posted his information in the chat box. We will keep a recording of the chat. So if there's anything that was mentioned that you all had questions about, let us know.
Yeah, work smarter and not harder by empowering youth and community stakeholders. Yes, Deb.
Harness some of that energy. Okay, our next presentation. It doesn't look, oh, here we go. Diversity, equity, and inclusion in youth prevention. How many of you all are signed up for that already? Woohoo! Looks like Lori is going to post a link in the chat box that will lead you straight to the registration for this training. Is that right? No, it doesn't look like it's in our agenda. We will send that with the to you, unless you can grab that real quick, Derek. We'll send that along with the materials next week so that you all can get registered. Anything you want to say about that training, Derek?
I'd just like to say that it's going to be a very powerful experience. We're going to explain the three-pronged term called diversity, equity, and inclusion and its principles. And we're also going to discuss how DEI principles can be interwoven with the strategic prevention framework steps. So you can yield changes that can enhance prevention efforts holistically.
Okay, thank you. That was a good explanation. So that's coming up in June. We have a lot of resources. Derek talked a lot about several different resources. Those are listed here. We have some other references that you can take advantage of as well. And last but not least, we would really appreciate it if you would complete the survey. If you don't complete it here, we'll send it out. And once we close Zoom today, you'll be taken straight to that link. You can also use the QR code and take a picture of that with your phone and complete it straight from your phone. So easy peasy. What else do we have? So we'll leave that there for a minute. Does anyone need us to leave that there?
Thank you so much.
Yes. And so next is Derek's information. I'm having a hard time moving the slides occasionally. There we go. Derek's email address so that you all can reach out to him. Again, so we had 143 of you all today. So please, if you can, it's very helpful to us to get your feedback. So please complete those evaluations. We want to thank you all so much for your participation. You had some great comments in the chat box, and I think that that was a great help to everyone participating, that we were all contributing to that. It wasn't just Derek's presentation, it was all of your ideas. So thank you for being here today and giving your time and your energy and being present. So we really appreciate that. Thank you all and have a wonderful rest of the day. And good luck with the work that you're doing. Let us know if there's anything that we can do to support you.
Adios, mi amigos, y goodbye, my friends.
Bye, everyone.